Good morning, everyone. Hello, and welcome to Dr. J's Prescription for Health. I am your host, Dr. Malea Jensen. I am a board-certified family physician. We're having a little bit of difficulty getting onto Instagram here, so let me give it another try. There we go. All right, we are live on Instagram and YouTube. So for those of you who do not know me, I'm Dr. Malea Jensen. I'm a board-certified family physician. I'm located in Des Moines, Iowa. Welcome to my live stream. I do this on Saturdays at 9 a.m. Central and Sunday at 10 a.m. Central. So good morning, Lucy and Douglas. Thank you for joining. We are live on Instagram and YouTube right now. We'll see how long that goes. I thought today we would talk a little bit about red blood cells. And so, again, this is your opportunity to ask questions. If you have a question in regards to anything I'm talking about or want to add to it, please do so. But today, I want to talk a little bit about red blood cells and good morning, Jerry. Jerry is listening from Boaz, Alabama. Nice. Good morning, Eddie. Yeah, I'm located in Des Moines, Iowa. Thank you for asking. I appreciate that. Okay, you guys, if you have not subscribed, please hit that that subscription button or the like or the heart or the join button. Let's get this stuff going. So red blood cell count and A1C. I've had this question on numerous occasions where somebody might be a carnivore. And being a carnivore, you have noticed that your A1C is going up. And for the most part, you've been taught or you've learned that A1C can go up in a carnivore because red blood cells last longer than usual, than a normal or an optimal 120 days. So they could be lasting 125 days or 130 days. And so the more and more exposure that a red blood cell has to glucose, the higher the A1C is. Remember, the hemoglobin A1C is a measure of glycated glucose. Glycated glucose. And what glycation means is a sugar, in this case glucose, binding to a protein, in this case hemoglobin. That binding is called glycation. It gums it up. And we measure a hemoglobin A1C, and that is usually a test of your blood sugars over the last 3 months. And so that can be skewed and is not always accurate. For instance, if you are a carnivore and your blood cells are lasting longer, you will note that your A1C is higher. Now, if you really want to know and say, oh my gosh, I'm still nervous, I don't know if my A1C is accurate, I'm afraid of getting diabetes, could my carnivore diet be causing the diabetes or leading me into diabetes, then you might want to have your doctor get a reticulocyte count, okay? If your red blood cells are living longer, your reticulocyte count will be lower. That's telling me that your bone marrow is not pumping out a lot of brand new cells, okay? That's the red blood cells are not being turned over as fast. So they're living longer, so they're not being turned over as fast. So the reticulocyte count, which is kind of a count of baby cells, kinda. I just want to give you that. The bone marrow pumps out reticulocytes that can grow into healthier red blood cells over time. So a high reticulocyte count is an indication that your A1C could be falsely skewed, okay? And we need to look into that. Things that can, besides a carnivore diet, what else can affect the lifespan of your red blood cell count, okay? Chronic alcoholism, what does that do to your A1C? What's that going to do to the red blood cells? It is going to lower the lifespan of a red blood cell. So if you are a chronic alcoholic, your red blood cell count is going to be, it is going to turn over faster. And so the reticulocyte count will be elevated. Okay, what else? This is an interesting one, and I know you guys are aware of it, but phytosterols. Phytosterols is like cholesterol, but not. It is from plants. It's from seed oils. So phytosterols can actually destroy our red blood cells, damage them, injure them, however you want to say it. If the red blood cells are damaged, then they are being knocked off, so to speak, die prematurely. And so what will your A1C show in somebody who's eating a lot of phytosterols, eating a lot of plant foods, eating a lot of seed oils, which is eating a lot of processed foods? Their A1C can actually be falsely low. So, I can kind of tell. If I look at an individual and I see that their A1C is 4.9 and they got what I would consider a beer belly and maybe these skinny kind of muscular lower extremities like their calves, I'm going to think to myself that that is not a true reading, and I'm going to get some other testing. I might get a glycated albumin. That would be more accurate. It would be over the last 3 days, your 3 to 4, 72 hours. So just consider it the last week rather than your hemoglobin A1C is a measure of 3 months. So you can get a glycated albumin if your doctor knows how to read that. You could get a fructosamine if your doctor knows how to read that. So there are other ways to determine whether or not your A1C is really accurate. And I know it kind of freaks a lot of you guys out. And so it's worth looking into, but seed oils actually incorporate themselves into the cell membrane of a red blood cell, and they destroy it. The receptors are destroyed, but it destroys the membrane, and it can actually get incorporated inside the red blood cell, damaging the internal units of the red blood cell. So there's a lot that can go on when we are consuming phytosterols, which I consider basically from plants and basically seed oils, basically processed foods. Lucy asks, what is glycated albumin check for? It checks for diabetes. You can get a better result than an A1C sometimes. If you feel like your A1C checking for diabetes is skewed, then you might want to get a glycated albumin. Now, some labs are not checking it, okay? Some labs are not going to check whether, if you got glycated albumin, they just don't know how to check it. They may not know how to check a fructosamine, okay? Another thing that you could do is get a 24-hour continuous glucose monitor. Now, what does that measure? That actually does not measure your blood sugar in your bloodstream, okay? It measures blood sugar in interstitial fluid, not the bloodstream. And so it might not be as accurate. And a couple of ways that I'm thinking of right now that could actually skew your monitor, your continuous glucose monitor. You can use Freestyle or Dexcom or whichever you've chosen to use, or any of the over-the-counter ones. But things that can skew that is exercise. Anything that really increases blood flow past that interstitial fluid can increase your reading for blood sugar, okay? So blood sugar, when we increase blood flow, so exercise, basically your arteries are vasodilating, and glucose is allowed sometimes to go through the blood vessel and into the interstitial fluid, and that is what the continuous glucose monitor is, on the back of your arm. That's what it's measuring is that interstitial blood sugar. So exercise can increase blood flow. So can if you are in a hot shower. Hot shower will vasodilate your arteries and increase blood flow, leading to increased blood sugar in the interstitial fluid. So we have to be very careful And your doctor should be able to explain these things. As a reminder, this is not medical advice, okay? Yes, I'm a physician, but you guys are not my patients. This is for information purposes only. And that, like I said, is a disclaimer. This is not, I want you to take this information and take it back to your primary care physician or your cardiologist or your rheumatologist or whatever doctor that you use. What would cause white blood cell count to be low in an alcoholic? Well, anything in an alcohol, all of your blood count can be altered, high or low, when you are an alcoholic. But you have to ask yourself that, or tell yourself that if the red blood cells, Lara, are having a problem, your white blood cells are going to have a problem. Remember, your bone marrow is producing your cells, your blood cells, okay? And so if you have a problem with the red blood cells, you're also going to have a problem likely with your white blood cells. Now, yes, a low white blood cell count could be inflammation. Yes. Could it be infection? Absolutely. Could be a viral infection. Okay, good questions. Let me see if I missed one earlier. I thought I missed one earlier. Okay, I guess I didn't. I'll keep going here because I thought I'd missed a question. So when we're talking about the hemoglobin A1C, and it's a measure of glycated glucose, it does not measure glycated fructose, okay? Fructose is not glucose, and an A1C does not measure fructose. So if you are consuming fruit or any type of high fructose corn syrup, the A1C will not measure that. It absolutely will not. You can check a fructose glycation by checking a uric acid. Usually a uric acid to fructose will be in a 1-to-1 ratio. Again, a lot of doctors do not check that, and they don't realize that they are a 1-to-1 ratio. I would say that you need to also be aware that if we're actually monitoring glycation is sugar binding to a protein. Fructose, a sugar, is glycated at least 10 times faster than glucose. So, again, consuming fructose via fruit and high fructose corn syrup is not in your best interest. Yogi, thank you for the kudos. I appreciate that. Here's a question. Is it safe to have ginger tea every day? Again, that is a plant, and it's a root plant, and root plants grow under the soil, and, we don't know the health of our soil. I guess I can't recommend eating any type of root plant, let alone any plant at all. When we have herbicides, pesticides, if we have glyphosate as an example in our crops, in the soil is taking that up. And then again, that root plant is growing underneath, inside that soil, which is absorbing all of the herbicide or all of the pesticide. So all of the glyphosate that is on that surface or inside the soil, it's just incorporating itself inside the plant. Glyphosate will incorporate itself inside a wheat plant or oat plant, a soy plant, a ginger plant, okay, or turmeric or any of those. And so you are consuming a plant, and you have to weigh the risks and the benefits. People say, "Oh yeah, but I do it as an anti-inflammatory." Well, that's fine. You can do that as an anti-inflammatory, but you have to also weigh all the risks of eating root plants or plants in general. Yeah, that's what I would say about that. The questions on YouTube are going really fast, and I really can't keep up. Yeah, same thing with a sweet potato. It is a root plant. It's going to grow under the ground, any potato. So you're soaking up, that plant is soaking up everything that is in the soil. Our soil in modern times is very deplete of nutrients, and anything that, an herbicide or a pesticide, it's going to incorporate itself from the soil into that plant. And then because that plant does not grow up, at least like a tea plant, some of the plants will grow above, like green tea or black tea, it's above the ground. A coffee plant grows above the ground. So those are a little safer, but again, any plant is full of other anti-nutrients like oxalates, phytates, that sort of thing. I mean, you have to know what you're getting into when you're consuming any type of plant, okay, that grows in our modern ground. The soil is depleted. It's very thin. We used to have a topsoil that was, 6 inches deep, and now it's probably 1/8 of an inch deep. If you're asking if you could grow your own plants, like grow your own turmeric or your own basil, your own whatever, I would definitely get organic soil to grow it in, and I wouldn't let the rain come down on it. I would probably use filtered water, reverse osmosis water, but you'd have to keep it covered up. So you'd have to put it in an umbrella or some sort of a covered house that would still get sunlight. So there's a lot of things to consider, or don't consider them at all. I'm just giving you some ideas to think about when you are wanting to consume, you're not only consuming glyphosate, but you're consuming every other heavy metal that's being sprayed onto our land. Okay, heavy metals like arsenic and cadmium, mercury. The CK says, so having a handful of organic blueberries with my 4 eggs isn't a good idea. Well, you have to ask yourself what you're eating the blueberries for, and what is a good idea for you and a good idea for me is totally different. You have to weigh all the pros and the cons, okay? You have to weigh the benefits of why you want to eat a blueberry. If you're saying you want to eat a blueberry for the nutrients, the ability of you to probably absorb those nutrients is pretty small. And so what you're getting in those blueberries is probably very minimal, if any at all. And any plant will have anti-nutrients, which will actually increase our problem with absorbing any nutrients. But again, if you feel that you want the blueberries with your 4 eggs, then, that is, you have free choice and you have free will. And if you have enough information to make a decision and you say, I hear you, Dr. J, but I still want to have my blueberries, then have your blueberries, okay? Good morning, Dennis. Cisco says, what's wrong with rainwater? Well, the rain contains there's a lot of chemicals in the air. When the rain collects and comes down, it's going to bring with it all of the things that are sprayed in the air. Okay, so if you live in farmland area, like in a rural area, everything that was sprayed on the land is going to be in the air and rain, and it accumulates in clouds, and those rain and it comes down, and then it's going to be even more accumulated on your plants. Okay? So you have to decide on whether or not you want to allow the rainwater to come down and further intoxicate your plants that you're trying to grow in. I mean, I wouldn't waste my money on organic soil if you're going to just use rainwater and allow it to be exposed to the elements. Grabiel asks, if you have rheumatoid arthritis, does it make you more susceptible for negative side effects from seed oils? Well, what caused your rheumatoid? Which one came first? Was the seed oils the cause of your rheumatoid arthritis? It's quite possible. So rheumatoid arthritis is an inflammatory condition. What increases inflammation? Could it be heavy metals? Could it be insulin resistance, so hyperglycemia? And hyperinsulinemia? Could it be glyphosate? Could it be nicotine, alcohol? So all of these things could increase an inflammatory reaction, leading to an autoimmune condition. In your case, rheumatoid, or in another case, Hashimoto's or lupus, or whatever the autoimmune disorder is. And seed oils are also very inflammatory. So when you incorporate seed oils into a cell membrane, not just a red blood cell, but any cell membrane, like maybe a fat cell, you are increasing the risk of oxidation. Seed oils are polyunsaturated, meaning they have multiple double bonds. And wherever there is a double bond, you can have oxidation occur. If the fat is saturated, it means it has no double bonds, so it is stable and it resists oxidation. So a polyunsaturated fatty acid, in this case, you're asking about a seed oil, which is omega-6, has many double bonds that are exposed to oxidation. And oxidation causes free radicals. And now you're going to need antioxidants to come and save the day. Can you keep up with it? Likely not. Also remember that seed oils can live in and on cells, on the cell membrane, as well as inside, even on a mitochondrial cell membrane, and they can destroy that cell membrane, and they can do it over a 3 to 4 year period. Seed oils stay in our body for long periods of time. Lara says she's answering Cisco and says heavy metals and toxins. That's why you do not want to use rainwater, or may not want to. You can do whatever you want. Okay. You're welcome, Cisco. Okay, have a good day, Lucy. Thank you for listening. Thanks for stopping by. Interesting take. Thank you. You're very welcome. EK, I am from the United States. I'm from Iowa. And it is 10:24 Central here. If you were to deplete nutrients, then how would a healthy plant grow? Well, I guess you'd have to define healthy. But all plants are able to withstand the elements. They can withstand elements. However, when we eat them, that's what I'm talking about. There are plants don't want to die. They will want to thrive. So they don't want us eating them. And so they have anti-nutrients. And those anti-nutrients, whether it be oxalates or phytates or tannins or there's lectins, they decrease the absorption of nutrients that we might need, okay? Some of those could be B12. If we don't have B12, we're at risk of dementia or depression or any brain disorder, okay? Any anti-nutrient can decrease most all absorption of positive ions. Calcium, magnesium, zinc, selenium, all of those have a decreased absorption. Iron, decreased absorption. So nobody will tell you that when you are, consuming plants. They're not going to tell you there's anti-nutrients, but they will tell you, hey, if you're going to do this plant-based diet, I really recommend you take B12. Oh, why is that? Well, because plants don't have B12. And when they're mixed with other things that do have B12, then it decreases the absorption of that B12. Oh, I didn't know that. So should you take B12 if you're plant-based? Yes. What kind? A methylated cobalamin. Okay. You don't want to take cyanocobalamin. You want to take methylcobalamin. So a methylated B12, a methylated B vitamin, because you don't want to risk getting dementia with your plant-based diet, right? Okay. Okay. Jennifer says that's why so many people feel better on carnivore. I have heard that. I mean, most people who go to a carnivore diet, it's because they were feeling kind of crappy on another diet. It is not so much that the carnivore diet is making them feel good, it's actually what they take away. So for instance, with myself, when I started taking away plants, I noticed that my bowels were better. It was less crampy abdominal pain. My aches and pains went away, like my shoulder pains. It just completely stopped. I mean, I would have trouble sleeping at night. When I went near carnivore, I can't tell you that I'm completely carnivore because I do drink coffee. I drink a plant, okay? So I'm getting anti-nutrients. So I know I have enough information for me to make a good decision. Could I stop drinking coffee? Easily. I choose to do it. And so you have to choose with enough information, make a decision if you want to continue doing that. If you say, gosh, I was wondering why my shoulders continue to hurt, and you're still drinking coffee, take it out for a few days and see if your shoulder aches and pains go away. And they most likely will. Or peanut butter, or whatever plant you're eating. So carnivore diet is kind of miraculous in the fact that it's not really what the animals are doing to you, the animal-based diet, it's actually what you took away. I mean, I'm telling you that the most nutritious diet you can eat is an animal-based diet. How would you eat then if you are avoiding all the things growing from the earth? Well, you would eat animals only, because anything that comes from an animal, or anything that comes from a plant, does not come from an animal. Can you give advice on how to strengthen stomach acid? What makes you think that your stomach acid is not strong? You know, one of the things that I don't think doctors take an initiative on is when dealing with polypharmacy. You know, it's very easy for doctors today. I don't know where you guys are from, but I'm just speaking from America because I can only speak for America, and I can only speak for the doctors because I am one. When patients come into us and they're on 17, 18, 19 medications, I believe in my heart that it is negligence if the doctor does not go over each and every one of those medications. And I think that the patient needs to educate themselves and look up side effects of all of their medications and take it to their doctor and say, hey, I got muscle aches and pains, or I got this. Could it be from this? Because I read that this is a side effect. You see, your doctor does not want to do that. If you're on 15 medicines, you know what they're going to do? They're going to send you to a PharmD. A PharmD will go over every one of your medications. You'll schedule another visit, but your doctor's not going to do it because that would take an hour to go over the medications. Each side effect? Yeah. So is it negligence? Possibly, if your doctor is not looking into it and just simply refills all of your medications. I think every one of you needs to know why you are on a particular medication. What is the reason? What is the diagnosis? Hold, please. Quiet. No bark. No bark. Tootsie's probably barking at a leaf out there. It's funny. It's funny. Okay, so polypharmacy. At this point, almost 60 to 65 to 70% of the population is on statins. A person who's on a statin does not know anything about the unpublished data. Why? Because it's not available. It's not even available to the doctors. What do I mean by this? The side effect data. The side effect data is not available to us. Either the time is expired and in their agreement, they don't have to provide that to you. I don't know the reason. but that data is unavailable. We do know that there are side effects to statins. Could it increase your risk of cancer? Yes. Myalgias or muscle aches and pains? Yes. Cooking of your liver, as in liver dysfunction? Yes. Diabetes? Yes. Dementia? Yes. All of these things. In fact, in all reality, the benefit of a statin is marginal at best. You might gain 5, 6, 7 days of life expectancy by taking a statin for 5 to 10 years. What does a statin do? I mean, in all fairness, there's a couple of things that statins are fairly good at, but I can give you another thing that's even better than a statin. So statins decrease inflammation. They're anti-inflammatory. They're like an Advil. I'm just giving you it. That is not the truth, but I'm just saying, like Advil is an anti-inflammatory. So statins are anti-inflammatory. They also decrease the ability to make blood clots. Okay? So could it be considered anti-thrombotic? Yes. But is there better ways? Yes. The reason they have increased risks, or a person has increased risk of blood clots, is because they have inflammation. So what is the best diet to decrease inflammation? Usually what we're eating is causing inflammation and increasing your risk of inflammation. Something you're eating. And it's usually from a plant. It's a carbohydrate. If you decrease the plants in your diet and you consume an animal-based diet, your inflammation will go down, even more so than taking a statin. If you decrease the inflammation, you decrease your risk of having a blood clot. Now, most people that are on statins are also on what? Maybe 2 blood pressure medicines, 2 diabetes medicines, maybe a muscle ache medicine because the statin causes the muscle aches. So you're going to be on something else, like a muscle relaxer or an anti-inflammatory, which by itself will cause another problem, anti-inflammatories. I mean, how good is that on your gastric contents, your stomach? What is that doing to your stomach? What is that doing to your blood clot factors? If you're on 2 blood pressure medicines and one of them happens to be a calcium channel blocker, and you've noticed that you got swelling in your lower extremities, and the doctor goes, oh, you got some edema. And then they what? Give you a diuretic? Oh, you get some swelling. Well, that could be from the heart, or it could be from the medication, because calcium channel blockers like Norvasc or amlodipine, the other name for Norvasc is amlodipine. Yeah, that increases peripheral edema, swelling in your lower extremities. So instead of changing or acknowledging the fact that your calcium channel blocker is causing the swelling in your legs, they're just going to give you a diuretic. Now, the diuretic will require you, to pee a lot? And then, unfortunately, you become incontinent because you can't get to the bathroom in time. And now they're going to give you a medicine to help with your incontinence. That happens to be an anticholinergic. Now you're getting a dry mouth. So you drink more, you pee more, you need more incontinence medicine, on and on and on. Along with the statins have an increased risk of causing diabetes. Now you're on a diabetes medication. You're going to start out with metformin probably because that's gold standard. And then they didn't tell you about diet. They didn't tell you about exercise. They might have sent you to a nutritionist, which knows absolutely nothing except for what they've been taught in their indoctrination school. So your diabetes medicine will soon bite the bullet, and you're going to have to add another one, maybe an SGLT2, which, causes you to pee more. So now you're on a diuretic, you're on an SGLT2, and it's just not working. So now they add a GLP. And you know what? GLPs have side effects. What are those, Dr. Jensen? Well, if you guys just do an AI check, like Grok or ChatGPT or something like that, you will find that there is upwards to 1,800 to 2,000 lawsuit cases just in the United States. And some of those are regarding permanent blindness, called NAION. NAION. Non-arteritic anterior ischemic neuropathy, optic neuropathy. You mean people are going blind from taking a GLP? Yes. You guys taking the GLPs, Wegovy and Ozempic, by the way, all of those 1,800 cases are just with Novo Nordisk. Yes, millions of dollars in lawsuits. There is a risk to everything. Doctors are giving GLP in your own gut. And you guys are the guinea pigs. So what doctors are doing with this polypharmacy is they're really not looking for root cause. They're looking for a Band-Aid, and that's called a pill for every ill. And if there's a pill for every ill, do you think that they're going to start looking for the root cause? Likely not. And so that leaves you to do your own medical care. And it's really unfortunate, but you should have been doing it anyway. And you should start now if you haven't already. You need to be your own advocate because honestly, your doctor is just checking labs. You're giving you basically a medication for everything that you have and ail you. Okay? If you got a hangnail, here's something for it. If you got a runny nose, here's a nose spray. What's in the nose spray? It's just a nasal corticosteroid. It won't hurt you. It doesn't go systemic. I didn't even ask if it went systemic. What if it does go systemic? Well, you know what? It's going to be in small doses. Well, is there anything else I can do? Well, what if you have a runny nose because you have GERD? And what's GERD? Gastroesophageal reflux disease. Well, I don't feel any heartburn. Well, you may not. It could be splashing up and your only symptom is what? A runny nose, a clear runny nose, or a tiny little tickle cough. You see, every medication has a problem. And so what are they going to do for your GERD? Well, that's a pill, right? You have an ill, GERD, and then there's a pill for it. It's called a PPI, proton pump inhibitor. It is going to stop the production of stomach acid, HCl, hydrochloric acid, from the parietal cells. It blocks it. So your pH is going to get higher. A normal pH of our stomach is between 1 and 3, say. That's what our stomach acid is. And it needs to be that way because our stomach needs to be sterile. It helps to fight bacteria. It also is at that pH because it allows for absorption of things we need, like B12 and iron and calcium and magnesium and zinc and selenium and amino acids. If you change the pH of your stomach contents, you can't absorb amino acids. That means protein. And now you risk getting what? Osteoporosis. You need protein for your bones. Oh, I need calcium too. Well, you're not absorbing in calcium because you're on a PPI. Oh, I better take calcium. So you're going to now take a supplement or medication to fight not getting osteoporosis, not getting dementia. You take a PPI, you don't absorb B12, no B12, dementia. I don't believe doctors are going through all of this with you guys. It's so important. There's something called informed consent, but you guys don't know that. You do now. You're hearing the terms maybe for the first time. Informed consent, meaning if I prescribe you something, I need to give you all of the information. What about statins? I would have to tell you that there are side effect data that is unavailable to us. Well, doctor, I've heard it causes muscle aches and pains. In some people, yes. What's that doing to me? Well, it could increase your risk of falling. If you have a muscle aches and pains, you get up too quickly, you could fall over. Okay, well, then there's other things. You see, all medications, with the exception of something called, when they're inhibiting something, like an HMG-CoA reductase inhibitor, it is blocking a normal biologic process in our body. So when we take a medication, it is blocking a normal pathway. And it's almost like telling God that he made a mistake. I don't really need cholesterol or vitamin D or CoQ10 or anything like that, then God must have made a mistake. He did not. You do need those things. So if your doctor did not tell you to take CoQ10 when you're put on a statin, he's doing you a disservice. He didn't give you informed consent because statin or very minimal amounts. And you need CoQ10 for other enzymatic reactions in your body. Well, you didn't know that? Well, you do now. And here's another kicker. If you're over the age of 50, 60, 70, guess what? You can't use CoQ10. You can't break it down into the usable form, which is ubiquinol. So your doctor needed to have known that too. And instead of prescribing you some CoQ10, they should have told you to take ubiquinol. There is a lot to know. And if you're on polypharmacy of 15, 16, 17, 10 medicines, they all have reactions in your body. They're all blocking normal biologic processes, and they all interact with each other, and they're all stopping something going on in your body to fix your ill. A pill for your ill. That's what modern United States of America doctors do. And they pat themselves on the back. How do I know? Because I did it. I prided myself in making a diagnosis because I was well read and I studied a lot and I listened and I did CME. I still do CME. I have to just get through it because it's all indoctrinated BS given to us with the same information of a pill for an ill. It's not, CME does not teach us to learn root cause. It's all about a process that's going on in your body and a medicine or a class of medications. They're unbiased, so they're not going to be toward a certain medication. But they could say a GLP and not say Wegovy or Ozempic or Trulicity or something like that. But they could say a GLP. So it's not non-pharma sponsored by a certain medication, a name, but a class of medications, yes. So they could teach you all about how GLPs work in our body or not. They might only give us half the information. They might not tell you that it can cause permanent blindness. They might not tell you that it can increase fat cell hyperplasia, that it can increase your risk of cancer. They might not tell you all that. They might not know. Well, then what's that? That's called negligence. Because you, doctor, are responsible for whatever you put that patient on, you're responsible. Well, what about the pharma company? They have indemnity for a lot of their medications. Who gave them the indemnity? The government. Well, why would they do that? Cha-ching, cha-ching, cha-ching. All about the money. You guys, you have to know why you have stuff going on. Why do you have a need for a statin? Well, my LDL is high. Well, what does that have to do with anything? Well, doesn't that cause coronary artery disease? Well, that's what they told you. And if you want to learn more, go to my yesterday's live stream that was on Instagram and Facebook, not YouTube. So you YouTubers who want to listen from yesterday, go to Instagram or Facebook and listen in. Center Stage Primary Care on Facebook. Otherwise, it's Iron Lady Doc. I am Iron Lady Doc on every platform except for Facebook. So I appreciate it if you would go to those platforms and like and subscribe and do the clickety-clack thing and help others. Because if you're being helped and you like it, maybe you could help somebody else. Maybe it's a coworker, a friend, or family. Maybe it's you. Okay? Here's another one that I always lead to with polypharmacy. Okay, so you're on the statin, which is causing cognitive decline. You're getting a little brain fog. You're just not remembering things very well. You can't keep your focus. So you go to the doctor and you think you have ADD, attention deficit disorder. You're older. You're not really hyperactive. You just got attention deficit. So they put you on what? A stimulant, right? And then the stimulant's going to cause problems. I had somebody ask me, they were in their 70s yesterday. They have an eating disorder. And a friend or family or coworker or somebody told them that they should go on Vyvanse, which is a stimulant. It's an amphetamine. Okay, it's speed. And this person also is at high risk for AFib. Now, what if this person went to the doctor didn't know they had AFib and said, hey, I heard that this medication, this Vyvanse, is good for some eating disorder like binge eating. And, well, can I go on some Vyvanse to help me to curb my binge eating? Oh, yeah. But here's some side effects. It could cause a little bit of anxiousness or nerves. Oh, I have anxiety, doctor. I'm glad you said something. Oh, it won't be so bad. The side effects are pretty minimal. And it might increase your heart rate. Well, if the person doesn't know that an increased heart rate is the same as having AFib or similar to AFib, then they might take this, go into AFib, get a blood clot, have a stroke, have a heart attack, and die right on the spot. Just because their doctor didn't look into things. Odd, right? So can you suggest something to heal ADD? An anti-inflammatory diet. You have lack of focus and brain fog and cognitive decline because likely of what you're eating. If you're eating polyunsaturated fatty acids and you're eating a lot of processed foods full of heavy metals, especially iron, you're eating a lot of sugar, you got type 3 diabetes, you're getting Alzheimer's, or you're getting dementia of some sort, stop the foods that are causing it. That's a simple way. Then you're treating the root cause and you're not doing a pill for every ill. Q-Tip says, what is the bare minimum exercise we need to get? I mean, that is going to be what is good for you. I would suggest if you're limited on time, I would lift weights. I would lift weights for 30 minutes a day at the bare minimum. You might want to take a couple days off. So 5 days a week, I would lift weights. I would do a different body part every single time I went in. I would get a trainer if I don't know how to do certain exercise, if I don't know how to work my back, my width and my thickness of my back, and I don't know the difference between my quadricep and my hamstrings, and I don't know the difference between my biceps or my triceps, or I may know the difference, but I don't know how to work them. You need a trainer. Get a trainer. You don't have to have a full-time trainer. Maybe you get a trainer for a couple visits and you learn how the different muscle groups, or you hire somebody to teach you about the muscle groups. If you want to consult on exercise programs and doing routines for you, email me. I'd be happy to do a consultation. You can email me at IronLadyDoc, IRON, Lady, LADY, Doc, DOC, at AOL. So IronLadyDoc at AOL.com. Sign up. The fee is minimal. It's $110 an hour to write out a program, and we talk about it. I don't know if that'll take an hour. It's up to you. How many questions you're going to ask? I can go over every exercise with you. I can go over your diet. I can go over your medications. I can go over your labs. That's what I do. That is my job. And I enjoy it. I really do. Vishnu wants to learn more about biology. I would go to YouTube and pull up people who teach. There's all kinds of courses on YouTube, all kinds of courses, very interesting courses. I have gone to a lot of them. One is Insulin IQ. Is it Insulin IQ? Something like that. There's wonderful. Just put it in the search bar. Doctor, is it true that stress is worse than everything else health-wise? Well, I mean, stress can cause a lot of problems. It can increase your blood sugar, increase your risk of cardiovascular disease, increase your risk of diabetes, increase your risk of dementia, but so can a lot of stuff. But yeah, stress it's bad. And people don't look for stress. They're just not, they say, I'm eating a carnivore diet, I'm exercising every day, my blood sugars are elevated. Why? Are you sleeping? No, I'm not sleeping. Why aren't you sleeping? Well, I'm stressed. Well, stress, not sleeping, raises cortisol. Cortisol raises blood sugar. Then during the day, to wake up, you got to drink some coffee. That's a sympathomimetic. So now you're increasing your sympathetic nervous system, which increases epinephrine and norepinephrine. Now you got more blood sugar. It's a never-ending situation. So yes, you might want to consider dealing with your stress. You got to increase your parasympathetic tone, do parasympathetic exercises or vagal tone exercises. No, I agree, Q-Tip. That's why I'm trying to keep it as simple as possible and teach you things. I'm trying to read you guys' questions. Dennis says, I got to have my bullet coffee. Go for it. Good morning, Jaco. I'm curious, if LDL can't fit into the cell, yesterday's talk, how can it fit when riding on cholesterol? It doesn't ride on cholesterol. Cholesterol rides in it. So the LDL is a lipoprotein that carries cholesterol. Cholesterol is not free in your bloodstream because it's fat soluble and blood is water soluble. So an LDL or an HDL carries cholesterol. That's why we measure LDL cholesterol, HDL cholesterol. If you get an advanced lipid test like an NMR, a nuclear magnetic resonance imaging, it's an MRI of your blood. It will give you particle numbers. How many LDLs do you have? What is the size of your LDLs? Does it matter? How many HDLs do you have? How big are they? What is the size of your HDLs? Does it matter? All of these things matter. Good morning, Christy. QQQ, here we go from Dennis. Have you heard about vegans and the government going after carnivore doctors like Sean Baker, Ken Berry, etc.? Google is tweaking the search algorithms to block searches for carnivore. Well, there was a recent study that just resurfaced. I believe, Dennis, don't quote me on this, but you can look it up. It's called Eat Lancet, EAT-LANCET. I believe it originally came out in 2019. And in the grand scheme, in the big picture of things, it talked about if people would just eat a plant-based diet, they would be free of any disease. If they would be healthy. And so it kept everything from an animal base to minimum, if at all. So in 2019, Eat Lancet, but in 2025, and I can't remember what month, it was earlier this, maybe April, I can't remember. The Eat Lancet got revisited. And in this, they pulled the top 25 or the top 15, like Sean Baker, like Georgia Ede, like Ken Berry, and more. And they pulled them and they named them almost in a slanderous way and said that they were giving misinformation or disinformation. And so I'm guessing there's probably going to be a lot of lawsuits in this regard by this study, labeling and giving a list of doctors who are called misinformants. And really, none of these organizations have given a reason for the misinformation. So they didn't say that, Dennis, they didn't say Sean Baker gave this information and it is found in here to be absolutely wrong and misinformation. So they're not really giving the information to the people that they put on the list. That's about what I know. And you can look it up, and I'm sure you can YouTube search Eat Lancet. It's a study that was done in the Lancet, which is one of the most highly regarded journals that doctors look at. Silva asks, what kind of seed oils are safe to use? I will tell you that the terrible 8 of seed oils are the 3 C's: canola, cottonseed, corn, the 3 S's: sunflower, safflower, soy, and as well as grapeseed and rice bran. I would probably avoid seed oils. They're very high in lectins. They're high in omega-6 linoleic acid, excuse me. Susan asks, where am I from? I'm from the United States. I am from Iowa. I need a steak. I sure do. Are you cooking? I would prefer ribeye. Actually, today I would like filet mignon. Let's see. JT says, I recently had a terrible B deficiency and almost died. It was rough. I'm sorry to hear that, JT. I hope you're doing well now. Oreo says, coffee is considered a drug. Look it up if you don't believe me. I do believe you. It is a drug. Thank you for adding that. I appreciate that. Yeah, JT. JT brings up a good point that I probably should also encourage you guys. Instead of just going and taking a B vitamin, you really should get your levels checked. Get all of your levels checked. Don't just take vitamin D, get your vitamin D level. Don't just take B vitamins. Don't just take zinc, and get all of your levels. If you want to know what's going on in your body, I would suggest getting labs. If your doctor won't order your labs, and you're desperate to have your labs checked, you can email me at IronLadyDoc@AOL.com. If you're in the United States, and if you're in 43 of the 50 states, I can order your labs. There are, I believe, 7 states that do not allow anyone to order labs without their personal doctor from their state to order them. Cisco says, stents, I got 2 of them. Doc said I'm to be on statins from now on. I hate it. So glad to hear your information. Yeah, and your stents are more at risk of having cardiovascular disease. You got to ask yourself, why did you have cardiovascular disease in the first place? What is it that you needed stents for? Also, did you check to see if on the angiogram you had collateral flow? Did the narrowing of the arteries that required the stents actually cause a heart tissue to die? Or did they just say you had angina, and then they saw on your angiogram that you had some narrowing, and they went in and stented that? Was there collateral blood flow? Was there damage to heart muscle? Those are questions that you guys need to know before you just jump to a procedure where they are now making you more at risk by inserting things that is a foreign body into your heart. Mulligan says, I'm 34, just went in for a wellness exam. Doctor said the cholesterol was high and said I needed a statin. I said, oh, wow, sure. I went home, read about it, and said, nope. I go back in December 1st. Doc said, I see you are very fit. So this brings up another question. Why is Mulligan's cholesterol high? And what does high cholesterol even mean? Did he or she, did they say it is your cholesterol that's high? Or did they say your LDL is high, your HDL is high, your triglycerides are high? What did they really say? And then you have to ask yourself, why is your cholesterol high? Do you have a B12 deficiency? A B12 deficiency will cause elevated cholesterol. So if you have a B12 deficiency, you have high cholesterol, and they just go put you on a statin for your high cholesterol? Or did they not look for a B12 deficiency? What about a folate deficiency? A folate deficiency can increase production of cholesterol. What about hemochromatosis? Hemochromatosis, a condition of blood cells, right? A lot of them. So hemochromatosis can increase cholesterol production. What about hypothyroidism? Did they check your TSH, your free T3, your free T4? Did they get a TG and a TPO? Did they check you for Hashimoto's? That can elevate your cholesterol. What about mold exposure? Did they even look into mold exposure? What if that was causing your high cholesterol? You guys, there's a lot of things that can elevate cholesterol. Satish Kumar says, how do you replace seed oils? You can use butter or lard, tallow, ghee. Those are great sources. Bacon grease. Will beta blockers kill you? It depends on what you're using the beta blocker for. That could kill you by not taking the beta blocker. But you could get depression with beta blockers. You can get worsening of your asthma with beta blockers. You can have a low heart rate with beta blockers, which could increase fatigue. You could increase your risk of depression because it slows you down. Those are things that might not kill you, but might make you miserable. But you have to ask yourself, why are you on a beta blocker? Mulligan says, I'm very fit and didn't know what diet helped or hurt cholesterol, but I don't eat any fruits or vegetables and have Crohn's. You have Crohn's. Well, why do you have Crohn's? Already, I'm trying more running and beef fiber and grapes and nuts and, well, if you have Crohn's, that's an inflammatory condition, and the things that you're eating, when you eat things that are high in lectins, you're increasing your risk of having inflammatory bowel disease, and one of those is Crohn's. So, Mulligan, you might want to try a lion diet for 30 days, a lion diet, which is meat, salt, and water, and see how your gut reacts. I imagine that your Crohn's will be gone. But nuts, oh my gosh, very, very high in lectins. Very, very high in lectins. Let me see. Instagrammers. Good morning, Christy. Thank you. Good stuff, right? Cisco, thanks for answering. I love your information. You're very welcome. Please share it, Cisco. If you find that it's good information, please share it with somebody that you care about or don't care about, a friend, a family, a coworker, brother, sister, mom, dad. Dennis says, I was riding my bike. I fell off and cut my arm requiring stitches. They prescribed a statin. Dennis, come on, are you fibbing us? Gabi, how is the weather here? It is about 50 and sunny in Iowa, in the United States. It's hard to read through the YouTube questions. It's very small. Alex says, I heard that the human body works in a pH range of 7 to 7.8. Depends on what part of the body that you are talking about, but not the stomach, okay? The stomach works at 1 to 3. You can look up what is the pH of normal blood, and then you'll know the pH of your blood. And our blood is about 5 liters in an average body. Eric, I don't know how to answer your question or if that is actually a question. Anthony says statins are horrible for the liver. Yeah, they're processed in the liver. Yeah, they're going to cause a lot of problems for your liver. And most of the time, you already have problems with your liver. You likely have fatty liver disease. You guys, if you're checking and worried about your cholesterol, you really should be looking at your triglyceride to HDL ratio. Your triglyceride to HDL ratio, that ratio should be 1 or less. Your triglycerides should be 70, your HDL should be 70. That is a 1-to-1 ratio, and that is a good result. If your triglycerides are less than your HDL, that's even better. Wandering Moon says, let's not forget about the Hippocratic oath they take. Do they even take it? You know, I was trying to remember when I graduated from medical school, if we recited the Hippocratic Oath. Because there are some universities I have heard that have changed the actual Hippocratic Oath. So you need to look into that. Wandering Moon says, why are you all here if you're not willing to learn? Go do some research. And that's, Wandering Moon, that's kind of what I love to do these live streams, or why I put up reels, is I want to encourage you to go look stuff up. Prove me wrong or prove me right. Go look stuff up. You need to expand your knowledge base. We have been fed, I think, a lot of lies in the past, okay? If we're being fed lies and you continue to repeat those lies often enough, you're going to believe it. And that's why it's so hard to fill people's brain with different experiences or different information. In order for you to incorporate different experiences or different information, you're going to have to let go of some of the things that you've been taught. So if I was taught for 30 years that LDL cholesterol causes coronary artery disease, I have to actually unlearn that. I have to empty out those experiences and replace them with different information. Maybe it's not LDL. Maybe it's inflammation and blood clots. Again, if you want to hear my live stream from yesterday, we talked about what I believe is the cause of coronary artery disease: heart attacks, strokes. Okay? Let's see. Uno, I agree with you. Monkey Business says, this is why I avoid drugs. That, and because my parents were addicts, I won't even take aspirin. I'm sorry to hear that. Good luck, Prince. I wish you well on your medical exam. Awesome. Thank you, River Rat. I appreciate your kudos. That warms my heart. Ash says, I have a question on SSRIs. What is your question on SSRIs? Tinnitus is a nightmare. Get your iron studies checked, Angie, or Angie. Get your iron levels checked. Get a free iron or a serum iron. Get a ferritin level, a transferrin level, and get a TIBC. I would also suggest getting a CBC. Get a liver function. Tinnitus is most often due to iron overload or hemochromatosis or even ferroptosis if you're that far along. Angie, you've likely suffered for a long time. We can have iron overload for years and years and years from eating plant-based foods, mainly processed foods that are full of fortified non-heme iron, and eating plants, which is also non-heme iron. So we cannot absorb non-heme iron, maybe 3%, whereas heme iron, which comes from animals, especially red meat, is about 30% absorbed. So the non-heme iron can build up in our cells, cause havoc, especially in the liver. That is one of the organs that iron likes to take down first. So I would look into these things. Let's see. My blood sugar is elevated because my liver is messed up, which was messed up because every base I worked at in the Marine Corps has toxic exposure. I'm sorry to hear that. Monkey Business says, I have tiny LDLs. How do I make them bigger? Stop eating processed food. Stop eating carbohydrates. Carbohydrates increase small, dense LDLs. If you want to decrease small, dense LDLs, get rid of your carbohydrates. If you want to increase your HDL, and especially increase the size of your HDL, you want to increase saturated fat intake. If you want to lower your triglycerides and you want to lower your ratio, triglyceride to HDL ratio, stop eating carbohydrates. Maria says doctors have to remember so much stuff. They do, but don't you likely think that they're only remembering just what they want to hear or want to remember? Right? They're just going to remember what they need to remember, how to make a diagnosis and what medications they need to give you. I don't know how to pronounce your name. Padraig says, does cholesterol that turns into hormones have a different form? Cholesterol has a chemical structure. In cholesterol, whether it's in LDL lipoproteins or if it's in HDL lipoproteins, it has the same chemical structure. So cholesterol does not change its chemical structure. Now, if you are talking about hormones, saturated fat, so animal is cholesterol. If you're talking about plant types of, it's not cholesterol, but it's called phytosterols. It's a sterol. That is not cholesterol. They are different. Cholesterol comes from animals, and phytosterols come from plants. We cannot incorporate phytosterols into our cell membranes and make hormones. However, they can make, in a test tube, can make hormones synthetic-wise, plant-based wise, from phytosterols. Do you want to put phytosterols that we can't use in our body? That's up to you. That is up to you whether you want to. But I would ask, why do you have low hormones in the first place that you need to be replacing them? And the first thing I would do is look at your diet. Saturated fat helps lower LP little a. They will tell you that LP little a is hereditary and you cannot lower it. Although there's medications in the pipeline that lower LP little a. So which is it? Can you lower it and it's hereditary? Or you can't lower it and it's hereditary? I have seen people go on a carnivore diet and lower their LP little a. But I believe that you're talking about small, dense LDLs as well. And those are high in people who eat a lot of carbohydrates. They're getting oxidized. Those small, dense LDLs. So if you believe that LDL is the actual cause of a heart attack, I will tell you, keep reading, but I will tell you that the small, dense LDLs that are getting oxidized and being munched on by macrophages, which form foam cells, are inside the plaque. If I take a diagram and take and do a pathology report on the plaque of your internal your heart arteries, and I might see foam cells in there, there's going to be LDL. There's going to be small, dense LDLs. Something has caused the injury to your artery. It damages the glycocalyx, it damages the endothelial cells, and it develops a blood clot. And in that blood clot, to stabilize it and calcify it, is red blood cells and white blood cells and small, dense LDLs. And all of these things are in that plaque and stabilizing it. But yet, the data was not all made available to us. It was cherry-picked. Everything was cherry-picked. And they said, oh, it's LDL. Well, LDL cholesterol and HDL cholesterol are the exact same thing. I just got done telling you that the chemical formula is exactly the same. Okay. Monkey Business says there's a lot of corn in Iowa. I agree. We have a lot of monocropping here. It's destroying our soil, and they're putting more and more herbicides and pesticides. There's more glyphosate being used today than ever before in the last 10 years. It's incredibly high, and you guys are eating that food. Do you think that Iowa just supplies Iowa? No. Cisco says, do you believe in once or twice cheat meals a week? Why are you cheating on your meals? Why did you go to whatever meal you're on right now? Why are you cheating with it in the first place? So you could go back to feeling the way you did? That's up to you. I don't believe in any of that. So you have to decide, why did you go from whatever diet you were on to the current diet, and now you're going to cheat back with the things that caused your problems to go on to the new diet? I don't know. Are we using logic, Cisco? I'm not sure. Madeline says a filet with mushrooms. I'll skip the mushrooms. They're plants. They grow in the ground, and I won't eat them. So just the filet, maybe some topped with butter. Yes, Ansel Keys did cherry pick, Dennis. It was found out. I think it was Christopher Ramsden. Christopher Ramsden found all of the some hidden data in a basement of one of the family members of Ansel Keys. I think it was in 2019. We have known about this since 2019, that this is all fake. Monkey says, I'm chugging milk and still have low vitamin D. Why do you have low vitamin D? I would check your liver function. If your liver function is not good, your vitamin D will be low. If you have increased body fat, the fat will sequester your vitamin D. If you are skinny and eat a no-fat diet, you are not going to absorb your fat-soluble vitamins. That's A, D, E, and K. So there's many reasons why monkey business might have low vitamin D, and nobody's looked into it. And what is low? Like, what is your level? Quick says, you can replace your coffee with a healthier option by roasting dandelion. Dandelion is good, but there's a reason that you would use dandelion. I would use it in certain situations, okay? Otherwise, I'm not going to choose that plant. But you can, and that's awesome. Yeah, JP, vitamin D is fat soluble. You can overdose on it, especially if you have body fat. Let's see. Four Wheelan says you people have to diet and exercise. JP says we all act like heart disease and metabolic syndrome just happened in a vacuum, like decades of health choices didn't have a role. Same with that person with coronary artery disease. That plaquing took years of causing that plaque. Years. And if plaque is higher in people who are insulin resistant or diabetic, high in people who have exposures to heavy metals, what about nicotine or tobacco? What about alcohol use? What about polyunsaturated fatty acids in processed food? Those are things that most likely people have been doing for decades. And you see, they're not going to put everything, JP, they're not going to say that your heart disease was caused by insulin resistance, because that would mean that they would have to tell you what insulin resistance is, and they might not be able to do that, okay? They might tell you that diabetes is the #1 cause of coronary artery disease, but in the same breath, they're never going to tell you how to lower your risk of type 2 diabetes. They're just going to put you on a statin, which worsens your type 2 diabetes. I mean, it's really comical how doctors think. They either don't know or they don't care. I don't know which it is, but they're both negligence. Cisco, you can read The Big Fat Surprise by Nina Teakholz, The Big Fat Surprise. There's also a book called, it's something statin, and it's by a cardiologist. Their last name is Malhotra. Statin-free life. That's a good one. The Clot Thickens. It's a little more complicated, but The Clot Thickens was an excellent book by Malcolm Kendrick. So The Clot Thickens, The Big Fat Surprise, A Statin-Free Life. Those are good books that you could get. You're very welcome, Cisco. Yeah, Michael. Yeah, in these studies, they did lower cholesterol and did find the increased risk of dementia and Alzheimer's. I agree. Remember, when you're putting somebody on a statin, you're lowering their medication, or you're giving a medication to lower their cholesterol, right? That's carried in LDL. It's going to lower, statins lower LDL. They do. They lower all cholesterol. They're going to lower your HDL as well. People have told me they lower triglycerides. I have never seen a statin lower triglycerides. We used to put you on a statin and a fenofibrate at the same time. We did. I did. Until they told us that it was increasing the risk of, muscle aches and pains. And then they tried to get us to get everybody off of fenofibrate and just let the triglyceride levels go. How could we have lowered the triglycerides without putting you on a medicine? You got it. No carbohydrates. Michael has systemic neuropathy. Again, I would look into your iron levels. I would get a B12. I would get a folate. I would get a serum iron, a transferrin, a ferritin, a TIBC. I would get a CBC, and I'd get liver function. There's a reason why you have neuropathy. This and that says use cayenne for inflammation. Why not just get rid of whatever is causing inflammation? Subtract rather than add. JP says magnesium can modestly reduce blood pressure. Why is that? Because it's calming. Magnesium calms. Okay? If you calm, you could lower blood pressure. But why do you have blood pressure problems in the first place? The most common cause is elevated insulin resistance, hyperinsulinemia. If you lower your insulin by lowering your carbohydrates, your blood pressure comes down. Travis, that is a question I do not know enough to speak to it, okay? I apologize for that, but good question. JP, you are prescribed cisplatin for your headaches. Your headaches are much worse, but at least you lost weight. Was that a good trade-off for you, JP? Virginia asks, can carnivore help pulmonary hypertension? It can't hurt it. If you lower insulin, does it always translate into lowering your pulmonary hypertension? Not always. I've seen a few cases. Pulmonary hypertension, you got to look at the risk factors for congestive heart failure. Do you have diet? Do you have preserved ejection fraction? Your echo, you should have an echo, and you should know that what your ejection fraction is. It should be 60. Are there any Instagrammers? No, still no Instagram questions. Let's crack gate. Thank you. They said, stop this BS in chat. This doctor is providing consultation for free on YouTube. How many docs do that? Thanks, doc. You're very welcome. And thank you for acknowledging that. I do this for free. There are some people that help me out. They donate to me. They will consult with me. But yeah, this is something I want to share information. And there are other doctors who do this. One of our listeners mentioned a few of them: Sean Baker, Ken Berry, Georgia Eade, Dr. Paul Mason, Dr. Anthony Chafee. We're all out there trying to share different information. Could it possibly be wrong? Absolutely, you guys. Absolutely. But it could get you to start using your brain. You see, we get where we're in a tunnel vision. We got blinders, and whatever they're feeding us, we don't look at. It's like we're being fed this buffoonery. We're bamboozled. We're indoctrinated. We're fed lies, maybe. Okay? And I don't want that to happen to you. And so I'm trying to present to you a possibility that it could be totally something else. I'm just trying to get, what if it's not? Maybe, but what if it is? I'm just trying to get your brain to wake up and start using not just knowledge that you've obtained from somebody indoctrinating you with, like your doctor saying, well, LDL is the cause of heart disease. Well, how is it? Show me that mechanism, doctor. Well, just stop eating steak. Well, didn't they prove that if you stop eating steak, it didn't matter about your cholesterol? Yeah, but just stop anyway. Well, you know, you guys, you got to call your BS meter in your brain should be going off. Okay? Thank you for your service, CB. I appreciate that. Okay. Moonbeam says they're going to exit the platform because they're not learning anything. Truck mechanic listening from Saudi Arabia. Thank you. CB, where am I located? I'm in the United States, in Iowa. It's hard for me to go through all of these. There's no real questions from people. Casey has gastritis from years of being an alcoholic. So this is a case of rebound hypersecretion. Casey, you have what I'm guessing, I don't know, but it's possible you have a condition called rebound hypersecretion. So for instance, when we go on PPIs, proton pump inhibitor, so if you have gastritis, itis means inflammation of the stomach lining. And a lot of times doctors will put people on a PPI. And PPIs will block the production of hydrochloric acid from parietal cells. So it's going to lower the amount of acid that's being produced, okay? So it's actually kind of curbing hypersecretion. Now, when you're on that PPI, I did mention that it can decrease the absorption of calcium, magnesium, zinc, iron, amino acids, all your B vitamins. It can decrease the absorption of that. So being on a PPI is not really the answer. So if you say, oh my gosh, I'm just going to go off the PPI, don't do that. You need to wean off that slowly over time. So I don't know how long it's been. You said years of being an alcoholic, but how long have you been not an alcoholic and allowing your stomach lining to heal? That's the question, because you cannot just simply go off of your PPI rapidly, because I'm serious, you will get even more rebound hypersecretion of hydrochloric acid, and that is going to decrease the tone of the sphincter that bounces or that stops, that dumps from the esophagus into the stomach. That sphincter door will stay open and you're going to get reflux, and that acidic can increase our risk of Barrett's esophagus and cancer. Cisco says, have you written your book? No, I have not. If not, it would be wonderful. I have not, but thank you. Dennis says, after Ansel Keys, he no longer trusts the experts. What is an expert anyway? I don't know. Is that similar to an impert? Expert is an impert? Do you guys have any other questions? Oh boy, there's a lot. I'm just going to skip down to the very bottom. So I skipped everything. I'm going to the very bottom. Reggie says, my uric acid is always off the charts. I would, there's reasons why your uric acid could be elevated. You're either producing too much or you're not getting excreted enough. So you have to check kidney function. You also have to ask yourself, are you eating fruit? When you eat fruit, uric acid will go up. If you have kidney disorder, your uric acid will go up. Okay. Thank you, Reggie. I appreciate your thumbs up. Yeah, Asim Malhotra. Yeah, Asim Malhotra. He wrote the Statin-Free Life. And yes, he was on, I believe, I was told, I didn't watch him on that. I've heard him on other podcasts, but apparently, yes, he was on the Joe Rogan podcast. And I'm guessing he talked about statins, because that's a lot what Dr. Asim Malhotra talks about. Cisco is wondering about enlarged prostate. Again, I would definitely check your iron levels, get a serum iron, get a TIBC, a ferritin, a transferrin, a CBC, and check your liver. Prostate is an inflammatory condition. You don't want to be risking getting cancer. Cancers eat iron. They do? Yes, they do. Cancers eat sugar. Cancers eat L-glutamine or glutamine. The Great Cholesterol Myth. I'll have to read that. I'm not aware of that book. Thank you. Michael K says, do you have experience with proving ALS or other neurodegenerative diseases? Again, I would please check your iron studies, okay? Get a CBC, get your liver function. And yes, I have several people who are eating carnivore that have MS and Parkinson's, and they are in the process of reversing their disease. But I will tell you this, they also had severe iron overload, and they're also in the process of healing their non-heme iron overload. They have iron trapping, especially in their liver cells. Their liver is not working very well. They don't have any antioxidants. Why? Because they can't make glutathione. Why? Because they can't get amino acids, sulfur-bonded amino acids, cysteine and methionine that makes glutathione. They're not getting them. Even though you can intake all of this food, you're not being able to absorb them because you're eating plants or you're taking PPIs or some other medications. There is so much to go over, you guys. And each one of these questions, if somebody like Tammy from Virginia is asking questions, somebody else, thank you for asking a question. Somebody else has probably got the same question, like Michael K says, hey, any other neurodegenerative diseases that you're seeing? If you look at Dr. Sean Baker, and if you look at Dr. Anthony Chafee, both of them are doing studies right now on MS. So they held a study where they invited volunteers, if they have MS, to go into their study. So both Dr. Chafee, Chaffee, I'm aware of, have been doing studies on MS with carnivore diets. What was the breast cancer question? It went by so fast, I didn't see it. I apologize. Oh, you're very welcome, Virginia. Thanks for the kind words. Go lay down. Go lay down. You're very welcome, Reggie. I'm trying to read through for questions. I'm not seeing a lot here. Thank you, JM. I appreciate that. Michael is asking a question about ALS and severe iron deficiency. I would venture to guess that it's actually not iron deficiency, okay? I would venture to guess that you have pent up iron in your liver. You likely have a high hepcidin level. You have a low ferroportin level. You have trapped iron, non-heme iron, inside the liver, and it looks like it is low in the blood. So your ferritin can be very low, okay? And most doctors will say you have severe iron deficiency, but what you really need is to get rid of pent up iron that is in your liver. You won't know that unless you get liver function. Get a GGT, get a CBC. You need to figure out, why do you have severe iron deficiency? Because my guess is you don't. My guess is you have actually iron overload, and you probably, at this point, if it's severe, you have ferroptosis. You are killing your cells, your liver cells. If iron is getting in the membrane, getting inside the hepatocytes, it is killing your liver cells. That's called ferroptosis. They're dying, a condition of dying cells. Iron overload. Get more labs. Reggie, on the breast cancer, I don't know if you can actually get blood markers that will do progress. Usually, those are with serial CT MRIs. There isn't that I'm aware of. I don't know because I don't treat cancer. Whether or not there are things you can check in your bloodstream to monitor, you either have the gene or you don't have the gene. What is the best magnesium? It depends on what you're using it for. If you need to have a bowel movement, you want to choose magnesium oxide or magnesium citrate. If you want better brain function, if you feel like your brain is low in magnesium, one of the only ones that cross the blood-brain barrier is L-threonate. So you would want to do threonate. You can get a combination of glycinate and orotate and malate and threonate. You can get a combination magnesium, and then you're helping your heart, your brain, everything. Do you need magnesium? Did you get an RBC magnesium level? What vitamins do I suggest for good hair? I would suggest no vitamins. I would suggest your diet. I would want to know what you are eating. If you are only eating plant-based foods, you are going to have hair loss. I would check your thyroid. Correct, Reggie. Iron is something you can't live with, or, you need it. You will die if you do not have iron. You just need it in the right places. And most people don't know that they have it in the wrong places. They actually think that they have iron deficiency and continue to feed themselves full of non-heme iron. They're taking synthetic iron. They're making their problem even worse. They're destroying their liver. It's unfortunate. Okay. Love Gupta says keto. Good. All right, you guys. I think that is all of our questions. Let me check over here on Instagram. Yeah. That's good. Okay, you guys. We will call it quits. I so appreciate you guys listening in. I enjoy every one of you. I appreciate the kudos, the thumbs up, and all of that stuff. So if you want, subscribe on YouTube, Iron Lady Doc. Go over to Instagram. I'm on Facebook at Center Stage Primary Care. I'm also on Rumble. What else am I on? It's Iron Lady Doc. If you're looking for me, just look at Iron Lady Doc. With the exception of Facebook, it's Center Stage Primary Care. All right, you guys. I hope you have a beautiful rest of your Sunday. See you next Saturday, Lord willing. I will be back 9 a.m. Central. See ya.